take a look at our best sellers.
Can you ovulate more than once per month or cycle? Although uncommon, ovulation can occur twice a month due to hormone changes. If you have been trying to conceive, you may have heard of ovulation. Your fertile period, or ovulatory days, is crucial in planning your baby. These are the days your ovary releases an egg. However, can you ovulate twice in a month? It is universally proven that women ovulate only once a month or cycle. You ovulate around day 14 of a 28-day menstrual cycle, and your most fertile days are days 12, 13, and 14. However, recent research shows that this may not be the case. So, can you ovulate twice in a month? According to a recent study conducted in the United States, women tend to ovulate more than once a month. This could provide a better window of opportunity to conceive, increasing the chances of a successful pregnancy. The process of ovulation. Ovulation is an important part of a woman's menstrual cycle, where a mature ovarian follicle discharges a viable egg, also known as an ovum, oocyte or female gamete. On release, the egg travels down the fallopian tubules where fertilization may take place if it meets a sperm. Most women plan conception based on their ovulation calendar as it helps them identify their most fertile days. Timeline of a typical ovulation. A typical ovulation happens once in every menstrual cycle. The ovaries will produce egg-carrying cells or follicles. According to a meta-study by the SPD Development Company Limited, in women who have a 28-day cycle of menstruation, 20% of the population ovulated on the 14th day, 27% of them ovulated on the 15th day, and 21% ovulated on the 16th day. These follicles enable the production of a fertile egg. Once the sperm reaches the egg, fertilization takes place resulting in pregnancy. Predicting ovulation is tricky. Thus, experts advise that couples trying to conceive should have sex between days 7 and 20 of a woman's menstrual cycle. Transvaginal ultrasounds can help look for the signs of ovulation. Can you ovulate twice in a month? Well, real-time trials at fertility clinics declare the possibility of women ovulating more than once a month, 6–10% only. The trial involved evaluation via high-resolution transvaginal ultrasound of 60 women between the age group of 18 and 40 years. Measurement of the follicles of the subjects over a time span of 6 weeks revealed that at least 6 subjects ovulated twice. Causes for multiple ovulations. According to an animal study, researchers are now of the opinion that the hormone progesterone acts as a catalyst for multiple ovulations in a cycle and that a drop in the hormone's level may cause ovulation induction more than once. Corpus luteum produces progesterone which normally suppresses LH secretion and that in turn suppresses ovulation in a normal cycle. However, in certain rare situations, 2 waves of ovulation may occur. Corpus luteum may at times secrete a reproductive hormone called luteinizing hormone. The hormones secreted, this is progesterone and luteinizing hormone, decide the frequency of ovulation. Experts also opine that if the reproductive system produces a dominant follicle during a single cycle, it may trigger dual conception by enabling 2 waves releasing eggs in a single month. Factors that increase the probability of dual or more ovulation. There are high chances of ovulating more than once if you are undergoing infertility treatment. In IVF, we sometimes do double stimulation to retrieve more eggs where ovarian reserve is poor. IVF may increase the probability of dual ovulation. Family history also predisposes to multiple ovulations. Keeping track of dual ovulation. If you are keen on tracking the chances of dual ovulation in a single month, you should consult a reputed fertility specialist. You will need an expert who will thoroughly analyze your ovulation period and pattern to help you conceive. Quick tip. You may also use an at-home ovulation predictor kit to detect impending ovulation. These kits detect luteinizing hormone LH in the urine, which raises to trigger egg release during ovulation. General measures to apply during ovulation. The below measures can help you understand your ovulation cycle and plan your pregnancy better. The cervix will produce a clear thin liquid, cervical mucus, that stretches between the index finger and thumb. Calculate your fertile days based on the onset of your monthly periods. Keep track of the basal body temperature while ovulating. Boost chances of pregnancy with a timely intercourse with your partner. Frequently asked questions. 1. How many days after your period do you ovulate? Ovulation period occurs between day 11 and day 21 after your last period. 2. Do I ovulate on the same day every month? Every month and for each individual, ovulation time and duration could be different. Ovulation usually happens 14 days before the beginning of the next menstrual period, but this might vary depending on the duration of the menstrual cycle. For example, some women have 21-day periods, while others have 35-day cycles. Stress, illness, weight changes, and exercise routines can also influence ovulation. 3. Can I ovulate more the older I get? It is improbable that you ovulate more as you age because women have a fixed number of eggs in their ovaries. This number may decrease as you get older. So, are you trying to conceive or you've not been experiencing ovulation? You can book an appointment with me, or get my guidebook on how to get pregnant when you think you're out of options, or use my fertility combo.